Welcome to the Naval Postgraduate School Center for Homeland Defense and Security lecture and webinar series. On behalf of CHDS and our co-hosts, the Association of State and Territorial Health Officials, the Correctional Leaders Association, the International Association of Emergency Managers, the National Emergency Management Association, the CHDS Alumni Association, and the Naval Postgraduate School Alumni Association and Foundation. Thank you for joining us. In today's webinar, our panel of communications experts will discuss how today's leaders can build trust in an age of disinformation. A couple of administrative items to note before we start our program. All participant audio is muted, and all questions will be held until after our speakers' initial comments. Throughout the session, you are encouraged to submit questions using the Q&A box on your screen. We will answer as many of your live questions as time allows. We also received several questions from you before today's session, and we will try to get to as many of those as possible. Today's webinar is being recorded, and a link to the recording will be posted on the CHDS Executive Education Program website after today's session. At the end of the webinar, there will be a short survey that will pop up on your screen. We ask that you please take a moment to let us know your thoughts on today's program. And now, it's my pleasure to introduce our moderator for today's webinar. Dawn Wilson directs the Executive Education Program at the Center for Homeland Defense and Security, where her team delivers all of the center's executive education offerings, including workshops, symposia, short courses, and seminars for the nation's governors, mayors, and other senior officials. Prior to joining CHDS, Dawn worked closely with the nation's governors and mayors and advised local, state, and federal agencies around the country on a variety of legal, public policy, and strategic communications topics. Dawn, thank you for moderating today's program. Now I will turn it over to you.
Kat, thank you for that, and thank you to everyone for joining us today. We're going to tackle a conversation today with a panel of communications experts that's really confronting leaders around the globe, namely, how can we continue to build and maintain the public's trust in an age of misinformation and disinformation? And our experts are going to tell us a little bit about the difference between those two momentarily. Before we get into that, though, I'd like to introduce you briefly to our panel of experts. Julie Parker is a longtime member of our subject matter expert panel here at the Center for Homeland Defense and Security. Julie often lectures in our classrooms and in our seminars with governors and mayors around the country on communications topics. Throughout Julie's career, she has spent time both in front of and behind the camera, working with public safety leaders, where she has served as a senior advisor for media and communications with the International Association of Chiefs of Police, as well as a spokesperson for multiple police departments in the Washington, D.C. area. Before that, Julie was in front of the camera, working for 13 years as a broadcast journalist, also in Washington, D.C. I'm also joined today by Dr. Swapna Reddy. Swapna is a clinical assistant professor currently at Arizona State University in their College of Health Solutions. Swapna is often featured in both academic settings and in news outlets, speaking on healthcare and particularly access to healthcare for low-income communities, including and particularly focusing on women, children, and working families. Swapna brings to today's conversation an impressive portfolio in the law, as well as public policy, public health, and communications. And our third panelist today, Dr. Christie Roshke, is the managing director of the Newsco lab at the Walter Cronkite School of Journalism at Arizona State University. The Newsco lab's work helps people focus and understand in better ways to consume media and to interact with news and information. Before joining Arizona State, Christie served as an executive director at the National Public Radio's member station in Arizona and worked to empower new generations of media consumers and digital storytelling. Christie is a board member of the National Association for Media Literacy and Education and has taught journalism and media literacy courses at the high school and university level for over 17 years. Clearly, I'm joined today by a pretty impressive group of communications experts, and I'd like to jump right into our conversation. Christie, first, I'll turn to you. You often speak on media literacy topics and how leaders should address misinformation and disinformation. So before we even get into today's conversation, I'll ask you to open up with a few comments and maybe provide a little bit of information about the distinction between this misinformation and disinformation term. Christie,
Absolutely.
thanks for joining us.
Thank you so much for having us today. And yeah, I thought it would be good to kind of set the stage in terms of some common definitions and also just kind of give a general sense of this information ecosystem that we're all living in, particularly in the digital sphere, and why it can be so difficult for us to get the information we need. So I have a couple slides that are good we can put up right now. Thank you. So this first one is sort of setting the stage for definitions. So I think most of us have heard of misinformation and disinformation. Well, there's an organization called First Draft that does a lot of research around this subject area. They're really disinformation experts, and they've kind of turned it into a three-prong approach. I'm going to focus mostly on the mis and the dis, but since you're likely to see this as sort of the characteristics of what they call information disorder, I wanted to bring all of them up. So when we talk about misinformation, we're talking about false information, and that doesn't have to be intentional. And typically it's not. It's all the ways that we might unintentionally make a mistake. You know, news organizations, public information officials often don't have the best possible information, and we're talking so quickly, sometimes mistakes are made. So we would classify that as misinformation. It might include things also like maybe an incorrect caption or a headline that's slightly misleading. And also includes things like satire, which often mirrors the truth in ways closer than we'd like to admit, but is really meant for humorous purposes. And then we have disinformation that you'll sort of see in the middle of this Venn diagram. And I really think the importance here is the intention. So when we think of disinformation, we think of intentionally fabricated or deliberately manipulated content with the intent to harm. And so there's a number of different reasons why this might happen. A lot of times we think about this in terms of foreign actors or bad actors who are intentionally trying to sow discord. But we've seen that domestically happen as well. So again, it's kind of the difference between the intent when we have this intent to harm. And then First Draft takes it one step further to include malinformation, which we probably won't spend too much time talking about today, but that's kind of gets more into the scope of doxing. When you're deliberately sharing private or personal information with an intent to harm, this isn't this isn't misinformation, it's factual information, but it's private information about people. So they've characterized that as malinformation because there is still that intent to harm, but it's actually more on the lines of private personal information that people are making public. So we'll focus again more on the mis and the disinformation, but I just wanted to make those distinctions because I do think that we all of us on the call today and then in the audience see probably all of these things around the web. So in addition to kind of setting the stage for the definitions, I just kind of wanted to point out again, and I don't think this is new to anyone in the audience, but that the digital information ecosystem we live in is very confusing. There are so many outlets for information. Some are credible, some are not. Some are our friends and family, some are professional. We're all sort of competing with the same audience, and our attention as consumers is very distracted. The same thing is true with professional media in terms of distinguishing between news content and opinion content. So I just kind of wanted to put out there for us, to frame the discussion today that people who are using media are often very confused by what it is that they're seeing because it all kind of looks the same online and it's not labeled as definitively and explicitly as it is maybe it used to be in a print product or even on TV. We kind of have a better sense of what we're seeing because it's labeled in such a way. But as we veer more into opinion content, that gets very confusing to people. And a lot of times people classify things as misinformation when really it's someone's opinion meant to persuade. So I just wanted to kind of bring that up as we get going today. And then the last slide I have to share up top here is where I think there's an opportunity for many of the people that are in the audience today, and certainly this informs a lot of my work, which is when we think about the decline in trust in institutes, which is a very real trend in our world, not just in the US, but globally today. Research also shows that mistrust is really more at the organizational or the national level. And I consider that to be sort of this existential lack of trust, where it's like, I'm not sure I can trust the government. I'm not sure I can trust the media. I'm not sure I can trust these institutions as a whole. But at the local and individual level, the trust is actually much greater. So I might trust my local law enforcement official or my local journalist in this way that I recognize, while at the same time maybe saying that I don't trust the institution. So a lot of times when we see these statistics, which frankly aren't great about the vast distrust in our society, I just want to make the point that we're talking structure, but at the local level, there are things that we can do, I believe, to help improve, repair those relationships. So that's kind of what I wanted to start with today to inform the conversation.
Thank you, Christie. Swapna, you've certainly observed how mis and disinformation have affected the public health community as we've tried to respond adequately and responsibly to the COVID-19 pandemic. I wonder if you might get us started today with some thoughts on how mis and disinformation have affected that mission.
Of course, and thank you so much for having me today. Similar to Dr. Roshke, I just had a few slides to kind of help level set, especially as we think about how misinformation and disinformation has especially affected this global pandemic that we're all living through. It's really kind of important to just sort of recognize, as we're thinking about the COVID-19 pandemic, what we have here and what we are all living through, and we've been living through for about 11 months now, is this obviously highly infectious virus plus misinformation, right? So it's not just the virus, but it's also the misinformation that is equaled a perfect storm. And I want to just talk about that a little bit. It's really important to note that this phenomenon of an infectious virus or an infectious disease plus information producing poor outcomes is not necessarily new to COVID, but we're certainly seeing it at epic proportions due to the fact that this is a global pandemic. When we think about what those contributing factors are, what we know is that there, in some cases, is a lack of information. We're still catching up to the science. We're still catching up with the information about the virus, how it is spread, how we mitigate it, how we treat it, and sort of what are the cures, right? And really importantly here, we have lots of mixed messaging, right? So different kinds of messages, different kinds of information, and sometimes that are, highly conflicting with each other. We have conflicting, speaking of conflict, we have conflicting sources of information. So similar to sort of what Dr. Roshke was just saying, where we're getting our information can actually really shape and determine the type of information that we receive about this pandemic. Inconsistent policies, that's occurring at the organizational level, local level, state level, federal level, in some cases international levels, right? The types of policies that we have around things like masking, around what should be open, what should be closed. Schools are a great example. Different types of businesses are a great example. The policies are pretty much all over the place, and we'll speak a little bit more about that. And then this diminishing value of expertise, which is an incredibly interesting and tragic point that is highlighted, frankly, during this pandemic. This diminishing value on who is an expert, right? What qualifies as expertise? So those that we would kind of traditionally look to provide the information, to provide the trusted information and messaging. We have sort of mixed messaging and mixed sort of respect for those experts, and that's really hurt us in terms of how we are thinking about addressing and combating this virus. Now, it's really critical to note that all of these contributing factors are frankly not necessarily new to COVID-19, just think that we are experiencing them on a whole new level because of the nature of COVID-19. Sort of recent examples of other health issues that have been impacted by these contributing factors. Listen, Ebola, the mandatory school vaccinations, right? All really impacted by these factors. Next slide, please. And what we know in the medical community, research community, scientific community, public health community is that, look, we know this is going on. We know that this perfect storm of the virus plus misinformation is resulting in really poor health outcomes, and especially, disproportionately impacting obviously certain populations and certain locations more than others. This is just kind of an example of the fact that all of these medical journals, public health journals, entities, organizations are recognizing this, but in terms of how we're combating this, we're sort of one step behind. Next slide, please. And so it's critical to think about, why is quality information so vital for the COVID-19 pandemic? And then the flip side, why is misinformation so dangerous for the COVID-19 pandemic? Well, we know that the type of information that we're receiving, the quality of information that we're receiving, and frankly, the veracity of information that we're receiving influences personal and group beliefs. It influences personal and group behaviors, and it's influencing policies that govern our populations. And so as a result, this isn't just impactful at an individual level, but absolutely at the community level and state and national levels as well. Next slide, please. Examples of factors and kind of concepts that have been really impacted during this COVID-19 pandemic. Masks, right? We have received all kinds of mixed messaging, mixed information about masks. And even when that information started becoming more consistent from the scientific public health community, we're still having, in many cases, a public debate about masks. And then our policies are certainly quite mixed about masks. If we look at our country, for instance, we have 50 different states, we have 50 different approaches to masking, and sometimes we have even more than that because many of the mask policies that we have are really occurring at the local level. Same with social distancing, same with, what we understand, know about treatments. The controversy around the hydroxychloroquine as a potential treatment. It's obviously not an appropriate treatment, but really that sort of messaging, the suggestion around that as an appropriate treatment, we know actually had pretty severe health consequences for certain individuals. So this isn't just about information and messaging, but it's also many individuals are taking this to heart and change their behaviors as a result. And of course, we are currently living through how this is impacting vaccinations, right? We are embarking on probably the largest vaccination effort of our time, of our lives, and the way that we're receiving information, the quality of that information and the mixed messaging around that information, certainly actively on a daily basis impacting if people are willing to receive the vaccine, if they are encouraging others to receive the vaccine, and especially I would say important for certain populations that might have already had a hesitancy towards receiving the vaccine in the first place. And last slide, please. And so as we think about kind of the 100-foot perspective on what are the underlying drivers for how misinformation, information, hesitancy is driving our outcomes right now during the pandemic. Important as we think about the United States, this number one, tension between individual liberties and the public good. That is sort of the driving tension between all large public health policy tensions, controversies in the United States, right? Do we focus on individual liberties or do we focus on the public good? When does the public good become more important than individual liberties? And as we know, we all have very different opinions on this, and we have different policies on this, right? As I mentioned, 50 different states, and often 50 different approaches on if we're going to be focusing on individual liberties versus the public good. This is certainly nothing new to the pandemic. This has been an underlying driver in the United States, especially as it relates to health, for a solid 200 years. Number two, the evolving nature of science. And this is a key underlying driver here, which is really, as we know with science and the way that science works, science changes and it evolves. And as we are living through this pandemic, the science is literally changing, evolving, developing as we are watching it. So in the last 11 months, our understanding of the virus, of what causes the virus, how we protect ourselves from the virus, et cetera, has changed quite a bit. And that's been very frustrating for people in many cases and really led to much of this misinformation. I'll give you an example, masks. Right? In March of 2020, we were receiving very different information about masks, who needs to mask, how consistently do we need to mask, what are the correct and safe type of masking versus what we were receiving just a few months later. Well, our understanding of the importance of masking, right, and the data around it actually evolved quite a bit. But the information for the public actually still really needed to catch up. And so right now, you might have seen this, I'm sure that you have, lots of sort of public discourse still 11 months into this pandemic on masking. And a lot of times people will reference that kind of the message that we were receiving, or the messaging that we were receiving back in March 2020, without really recognizing, look, we've come a long way with this virus, right? And our understanding of this virus. That's because we've come a long way in our scientific understanding. Number three, cannot underscore this enough, the politicization of the virus. This virus should have never become political, should never continue to be political, because it is in fact a public health crisis that impacts all of us. But the politicization of the virus, of sort of the ideologies around mitigation, the ideology around vaccination, should this be a federal approach? Should this be a state approach? Should this be a local approach? I think many of us can recognize that politicization, regardless of what your ideology is, has certainly not done us any favors in this pandemic. And then number four, the inconsistent approaches. We have had many different approaches, whether it's at organizational levels, whether it's at political levels, in terms of how we are going to be approaching and combating this virus, and largely fueled by all kinds of information and misinformation that has been out there in the public sphere, but then also taken up as a mantle by some of our leaders. And so as we continue to think about how important information and receiving the correct information is with this pandemic, it's incredibly important to recognize kind of how did we get here, as we think about how we're going to be creating solutions to move forward. So I'll stop.
Thank you for those comments. Julie Parker, I'd like to turn to you. You spend your days working with practitioners in the public safety and the Homeland Security arena. What advice do you have for them, and thoughts for setting up today's conversation about how they really can maintain that trust in this age where they're combating mis and disinformation almost every moment of every day on the streets?
I think the key here is to become the source. As we have talked about already, there are so many distractions out there for all of us. We don't know where to look first. Despite the fact that we're all working at home for the most part, there is still so much coming at us on so many fronts. And so if you are, let's say, a police chief, an emergency manager, a public health official who is dealing with this pandemic, one of the best ways that you can combat misinformation is for the public to know who you are and to develop a trust, because they've gotten to know you, they've become familiar with the facts that you're sharing, provided that those facts are accurate, that they come out in a timely manner, and that you are someone that is, I would say, approachable, someone that they feel that they can place their trust in. Almost like, to a degree, you want to be able to be in a position where people will stop what they're doing and listen to you as the source. And with everything, whether it's a homicide or a pandemic, if the folks who are leading this particular incident or pandemic are available and have the information and share it on many, many platforms, not just, let's say, a news conference, but on social media, through a newsletter, through a town hall. There are so many different ways that our leaders can be available to people. And that's the kind of way that you build trust in the public.
Julie, thank you for kind of setting the stage for us also from a practitioner's point of view. And I'll open by asking, Christie, I'll start with you. Tell us a little bit about this element of building trust that we're talking about. Julie just talked about it a little bit. How can we do that? How can we, as public safety, Homeland Security, emergency management professionals, how can we maintain that integrity of pushing out the information and maybe not get caught up in that bias that now has been suggested that exists for the media?
Well, kind of building on what Julie said, I think for the most part, our public people really are doing their best to provide the most up-to-date, accurate, transparent information. But they can't control how that message is perceived or taken in. I mean, on the one hand, I say, keep doing what you're doing and do more of that, over communicating what we know, maybe admitting better what we don't know. I think that's a real key. And my colleagues on the panel have already mentioned that, because there is so much usually in a breaking news or, situation, even one that breaks over 11 months and seems to never end. There's always as much that we don't know that we do. And as professionals, it's hard for us to admit when we don't know something. So I think continuing along the path of open, clear communication, being as accurate as possible and admitting when something was not correct. But then I think because even when we do that, it seems like it's not enough these days. We have to address that too. It's really not enough just to continue to consistently put out accurate information. You also have to address the fact that some people won't hear it, even if it is accurate. So you have to work on building trust in those ways. And again, I think transparency plays a big role in that, but also I think empathy for our audiences, our intended audiences, knowing that there are people, as Dr. Reddy mentioned, who have some pretty deeply held beliefs that are becoming more entrenched, as months wear on, that we can't embarrass them out of believing those things. And it's really not our place to try to change their minds, but rather to try to help them understand how our accurate information really does fit into and is useful and necessary for their lives. Dismissing people for what we maybe think as our fringe or obviously incorrect beliefs is clearly not working. So I would recommend a change in tone there, and that's kind of where I would start.
Dr. Roshke, a follow-up question for you, but then I'll open it up to Dr. Reddy and to Julie as well. A lot of advanced questions for folks talking about not just their role as a communicator, but their role as a media consumer. Christie, you talk a lot about media literacy. So again, I'll throw it to you first and then to Swapna and then to Julie. A lot of questions from folks. How do we know what is credible information in news? How do we become ourselves a critical news consumer? Christie, what do you think about that?
I mean, it's a great question, and it's frankly quite difficult, even for me, someone who does this all day long. And I think that one thing is to approach everything with a healthy degree of skepticism. Be cynical. We don't want to be overly skeptical of everything, but to recognize that kind of all entities that are delivering a message typically have some point of view. Being mindful of that point of view that's not a negative thing. It's just kind of a fact of communication. We're coming from a particular place depending on our organization. So know that and being mindful of that as we're consuming information is important. And I just recommend to everyone that they try to get a nice scanning, diverse set of information. So different news outlets, including those that might have a meaning that's counter to our beliefs. We want to keep an focus on the whole story, because again, as communicators, if we have a particular worldview, certainly audience members that don't share that worldview, and if we can't understand what they're reading and seeing and listening to, we can't effectively communicate to them. So as practitioners, it's even more important to have a very global view of the information that's out there. I also think that sometimes something we don't do enough, and I tell this to my students all the time, is I consume media in a particular way that's different from, say, the other people in my household even. We're all looking at different sources. And sometimes professionally, I forget that. And I just assume everyone's like, I don't know, reading the New York Times every day and on Twitter 24 hours a day because that's what I do. So it's really important to remember that we're all consuming information, not only from different places, but in different ways through different modalities. So that we can address people in those modalities, reach them where they are. So it's complicated, and I don't usually share like a definitive source for news because I don't think there is a single definitive source. But there are certainly news organizations that have been around for, centuries, that have built a level of credibility, so we can give them the benefit of the doubt while having that healthy degree of skepticism.
Well, now, what about specifically in the health context, right? Lots of information coming at us from lots of different directions. How do the leaders viewing today decide what information they should consume in the COVID context and maybe advise their bosses and their communities to consume? Where do you point people?
Yeah, it's a great question. And you are right. We are being bombarded with health information, right? I think what's really key is to focus on two things. One is transparency, as Dr. Roshke just mentioned. Transparency, I think, is key, especially during this pandemic, admitting what we know, admitting what we don't know, which is often harder, right? And really starting to communicate in a way that is reflective of what the science of where the science is, which is, look, it's evolving. We're learning things. I know that this might not be what was said a few months ago, but this is where the data and the evidence brings us to at the moment. And probably a few months from now, we'll have a deeper understanding. And having that transparency, I think, is incredibly important, instead of pretending or trying to provide sort of this false impression that we have all the answers now, because we absolutely don't, especially with the pandemic, but especially when we think about a variety of health issues, right? And I think number two, in terms of pointing people to the right direction, it's incredibly important, especially when we're thinking about health and science and this pandemic, is to think about original sources, right? There is so much information and it gets filtered in many ways. And this is a conversation I have with students and, you know, family members all the time. Let's focus on where the information comes from. What is the source, right? So if someone says, I heard X, a really great sort of response is, what was the source? And sometimes that can be an obnoxious conversation point. We all know that, right? But from the health perspective, I think it's incredibly important to think about, where do we receive our other sort of trusted health information? Where does our data come from? You know, let's look at what the NIH has to say about it. Let's look at what the CDC has to say about it. When we say, you know, CDC standards, are we following CDC standards? Well, that's a great place to go and look and see, what are those standards and what are they based on, right? Looking at where the original data, the original science originates, I think is a great way to keep up with what the actual data says, to keep evidence-based and to keep really focused on the most current information, instead of sort of the filtered version of that information. Now, it doesn't necessarily mean that the filtered version is wrong. In many cases, it's sort of, you know, there's many attempts to make some of that original data easier to digest, right? And I think we all get it, because some of that original data, some of that original science isn't always so easy to digest. But I would argue that right now during the pandemic, a lot of sort of our larger institutions, where we generally go to for that trusted information, are actually working hard to make the information easier to digest. I think that's incredibly important. And, you know, think about kind of, where do you receive your own healthcare? If you trust, I mean, for instance, I'm here in Arizona and I'm at a major health system. I receive my healthcare at that health system as well, right? So if I trust them to help me with a whole bunch of other health issues, I'm going to trust what they say about the pandemic as well, right? And I trust what my physician has to say about the pandemic. I think it's really important to think about the source. It doesn't, you know, social media can sometimes be a good source, sometimes be a poor source, depends on what the media is, right? But really think about those original kind of sources. And I, you know, want to just reinforce and support what Dr. Roshke says. It's really key to understand the different narratives that exist right now, because in that way, we can become more effective at overcoming the false narratives, right? If we just pretend that, listen, why isn't everybody just on the NIH website all day? And why don't you know the same information I do, you know, and all the latest studies? And on your Twitter feed, why aren't you only reading what the NIH and the CDC has to say, right? And the AMA, et cetera. I think then we're completely lost in how to combat the false narratives, right, that exist. We cannot just live in our own silos. We need to be very exposed to all of the narratives.
Dr. Reddy, you teed up an important topic, and that's social media. Julie, you talk with Homeland Security leaders around the country all the time about social media. What advice do you have for them, not just about using social media for their own messages, but for their own consumption? How do they watch that? How do they decide from a situational perspective whether they're getting real information, acting upon it, and then pushing out their own messages?
I think it's very important for police chiefs, for example, to know where their departments live on social media. I can't tell you how many times, hey chief, great to meet you. Tell me about your Twitter feed. I think we have that. I think it's called XYZ. That's really important information for you to know, because it is a main way that your departments are messaging to the public. And also, in addition to that, do you have a trusted person at the helm of your social media platforms who are not only pushing out information, but they're not acting like digital bullhorns and just blasting out and not receiving the information? There are many ways for, let's go back to law enforcement, it's sort of my home base, where they're getting information from the public that's valuable in investigations simply because someone will tweet a video, they'll send a direct message on Facebook. There are opportunities there for that particular agency to benefit as a result of social media. A third component I would add is social media monitoring. So that doesn't just mean follow Twitter and scroll through all day like so many of us do. Be very conscious about what you're searching for when you're monitoring. So, for example, if an emergency manager is dealing with an approaching tornado, you're going to watch and you're getting ready for the warning, perhaps. Looking through social media specifically for something about that topic, whatever your topic is, and putting in search words. So if it's Montgomery County, Maryland, put that into your search and look for what conversations are taking place about whatever your incident is. The public may actually supply information that you can use. So while social media most definitely has its disadvantages, there are advantages if you know how to take advantage of them.
Christie, speaking of social media, several of our viewers sent in questions in advance to ask, how do they combat misinformation or disinformation that's being perpetrated, maybe accidentally, maybe purposely, that's negatively affecting their message to their communities?
Yeah, it's a great question and it's really hard. So I don't have a magic solution, but I do have some tips that can help because, you know, as we've sort of alluded to before, much of this, we're always sort of playing catch up, or we're in a very defensive stance where it can feel like we're just playing whack-a-mole. Like, now I'm seeing people talking about this, about the vaccine. How do I squash that? And how do I hit this one? And there's always going to be a new false narrative that comes up. I mean, it's very difficult for us to get ahead of that. So I think some of the things that have already been said are great tips. Continuing to share accurate, up-to-date information. I think Julie makes a really great point about how often people in leadership positions don't know enough about what's going on social media to help that drive a strategy from the top down, you know, a complete communication strategy where so much of this chatter, I mean, it's sort of like a disconnect. We know that social media is a great driver of misinformation. And all of us on this call know that now, but all of us are actively involved in that, which seems really wrong, right? Because if that's the place we should be to figure out how to solve it, we need people from all levels of all of our organizations. So continuing to put out credible, accurate, up-to-date information with context. Context is so important when you're the person delivering the correct, credible information, because we usually a lot of the ways misinformation gets spread is because we are out of context or we've misused the context of a situation to drive this misinformation. So we always want to put in context a lot of what's already been said. This is what we knew yesterday. This is what we know today. There's the press conference tomorrow where we'll probably learn more. This is the best way you can wrap up, the latest. The other thing I want to put out there, which, research supports more and more, and in case others aren't aware of this, it can actually be damaging in the attempt to debunk misinformation, to focus too much on the misinformation. So there's a lot of research that supports we don't want to repeat the lie because the lies are sticky. And once the lie gets in, it's really hard to change that narrative. And so, masks have been mentioned a couple of times. I think it's an ideal situation or an example. We didn't know about masks in the way that we know now. We've known we need to be wearing a mask for many, many months. And yet, every time we talk about masks, we have to talk about the fact that at one point there was a controversy. This perpetuates the myth that there's a controversy and it doesn't allow us to move on. Now we're in a place where they're starting to recommend we all wear N95s or we double up our masks because of new variants. We're still fighting the last mask battle. So how are we going to get into this mask battle, if we keep bringing up the lie? So at a certain point, a lot of researchers recommend something called the truth sandwich. I use this for feedback with my students. It's a very effective tool. You want to have the accurate information sandwich the thing that we're debunking, right? So the emphasis is not placed on the lie. And I'll just say one more thing from a technical, sort of tactical perspective. That means if you're in a position to write a headline, don't put the lie in a headline. Don't put the lie in a lead. Don't put the lie in a social media post. Put the truths in those places, because as well as I do that most of the time people are only scrolling and seeing what we're writing on social media and seeing a headline. They're not actually reading the press release or the story or watching the press conference.
Julie, you often talk about the fact that words matter and maybe even more so pictures matter. And I know you've worked with local communities in the COVID response and have seen mayors and maybe even some governors out talking about that. And the picture of whether to wear a mask may run counter to the visual of whether they're doing that. I wonder if you might share some stories and some observations you've seen recently with a journalist eye.
Sure. I'll give an example. I was recently at a conference in a state, and the governor took the opportunity to come visit that conference. And prior to his speaking, there was a moment of silence for members of that particular community who had died from COVID. So everything stopped. There was a moment of silence. And then there were speakers as well as the governor who then got up in this conference room during the pandemic, and those speakers, to include the governor, didn't have a mask on. And I thought about how dramatic a mixed message that was. And the picture is worth 1,000 words is a saying for a reason, because it's so incredibly powerful. And so we did this thing, we had this solemn moment, we thought about those lives lost, and then bam, in your face, it went counter to everything there. And so if you're in charge of hosting a news conference for your county executive, your mayor, your public health official, or your emergency managers and your police and fire folks need to stand up, think about all of the visuals involved. Where are you doing the news conference? If you're talking about a pandemic, do you have people appropriately distanced? Do you have them in masks? So it's beyond just the information that you're sharing. It's what you do. It's your actions that are part of your message.
Swapna, we received several advanced questions, and I see some coming in live as well today, really asking us, not to put you on the spot, but what kind of score, how do we grade what we've done as a country, or maybe even as a globe, around some of the health messaging in recent months? And is there any way to, one viewer asked, to kind of crowdsource information to decide how we need to tweak our messages, right? So to see what's being said and then maybe pivot, address that, and say something differently. Any advice for the viewers asking those questions today?
Yeah, well, it's a tough one about handing out scores. So, I'm a university professor as well, and I normally like to give grades, but this one I'm a little scared to give a grade here. Primarily because, look, it's, our public health, I think, messaging and approach has been mixed, not necessarily because the evidence has been so mixed or the data has been mixed. I think depending on what agency, entity, space that you're talking about, we've been given sort of a variety of leeway in how we can talk about this, right? And we, and I'm hoping that as we're moving forward here, that public health will be given more leeway, will be given more sort of freedom to actually be consistent and be evidence-based and have sort of consistent factual messaging. I think it's important to recognize, in the last 11 months, public health as an entity, and obviously that's a generalization, but as an entity hasn't always had the freedom to necessarily speak its truth and to say it in a way that's been in a way that's consistent with other behaviors and other policies that we've seen. So that's key right there. Number two, in terms of historically how public health has messaged, how public health has done in messaging, public health is often, while so well-meaning, and I come from public health, I heart public health, right? But while so well-meaning, we're often playing catch up. And I know the other panelists were talking about that as well. We're often playing catch up and having to combat these false narratives, combat these false concepts, right? Having to sort of come after some very effective messaging. And often what we're armed with is what feels kind of clunky, right? Like, oh, well, but this study said X, right? Or here we are with the science, we know this, we don't know this yet. And that's certainly not as sexy. It's not, memeable. It's certainly not, one sentence. And that's the stuff that that pushes, that's the stuff that gets spread. And sort of the way that we in public health often speak about things is just simply not as exciting. So I think, coming into this sort of next phase, really thinking about what are those false narratives that exist out there. We cannot pretend that they don't exist. And then how do we work towards creating messaging that, again, is science-based, that's evidence-based, that's fueled by data, but that also, doesn't take like an hour to explain, right? That maybe we can create a meme out of, and a responsible meme out of, or that is one sentence. I think that's going to be one of the great challenges moving forward, is how do we combat this really slick misinformation with slickish, at least accurate public health information is I think going to be one of the great challenges moving forward. And in terms of crowdsourcing, I just want to say one thing, which is, the messaging has been inconsistent, not just by public health agencies. And again, not because the information is inconsistent, but really, the messaging, as Julie just mentioned, from different leaders has been inconsistent, right? So I think it's really important now to say we need to take consistent approaches. We need to take coherent approaches to this pandemic or whatever kind of public emergency we're dealing with. We cannot say it's different if you live, say, in Arizona versus if you live, in New York, et cetera. I mean, we have to take kind of coherent, consistent approaches to these things and be comfortable with that. And that needs to come from leadership, and public health needs to help support that.
Christie, following that line of thought, lots of viewers ask, how can they communicate effectively when their public thinks that all news is fake news, that they've really kind of disposed of the credibility of the news and the media writ large? How do they overcome that type of cynicism in their communities?
It's tough. And part of it is just being aware of that and being mindful of that when you're craft messages, knowing that you have to kind of go the extra mile. So like I said before, sadly, it's not enough to know and that you are the experts. You also have to convince in some ways that you are. But I do also want to point out, and I kind of said this at the beginning, not that this doesn't happen at the local level, because it absolutely does, but the discussion around mis and disinformation is very much at the national level, federal level, even global level. At the local level, even while people are saying, you local news organization are fake news, they're still turning to that organization because that's where they get the information that they need. So I'll go back to this idea of usefulness. You need to know where to get a vaccine. You need to know what the process is to sign up to get a vaccine. You need to know when you're going to be eligible for that vaccine. We all know where we can find that information. We can go to our local news outlets, or we can go to local sources. So your county, departments of health, or state departments of health. And we have to, because those are the people that know this information. So there is this disconnect, almost a cognitive dissonance at the local level between, I'm going to say I don't trust these entities, but then I also need them, and I recognize that I need them to get the information. So it's important to remember, as the people who are relaying this information, they really do, they need you, even if they're not going to admit it. So the best way you can capitalize on that is to be fair, accurate, consistent, all of these things that we've been talking about, because in doing that, you're repairing that trust little by little, right? So it's really not about it, at least in my opinion. It's the losing battle to try to convince people that you're trustworthy in this broad, on a scale of 1 to 10 way, but rather prove your trustworthiness by continuing to give them the information that they need, that they can use. So being able to act upon the information that you're providing, what we as consumers of information need. So the more you do that, and the more consistently you do that, people kind of have no choice but to listen to you.
Dawn, can I add one more point to that?
Please.
I think that urgency is so key, because very often the wrong narrative that is shaped early and may have come from the loudest voice is the one that sticks. Christie used the phrase stickiness. Lies are sexy. The truth sometimes is boring. And if the lie gets out there early, or the misinformation, let's not call it a lie, maybe it's just misinformation in the beginning, with no bad intent. If that takes off early and is allowed to continue without the credible source coming out and saying, this is what we know right now. You may not know all of the facts right now, but this is what we know right now, and this is what can't change. I often use the example, tweet what won't change. So if a call came in at 9 a.m. for a shooting on Main Street, perhaps there wasn't a shooting on Main Street, but we do know that someone called in at 9 a.m. to say they heard a shooting on Main Street or saw a shooting on Main Street. So your story can build as you go, but it is important, regardless of what agency you're in, to get out as soon as possible regarding with whatever the incident is, to sort of put your stamp on it and to announce, we're here, we're looking into it, we're going to inform you, stay tuned.
Julie, I'm watching the questions come in live, and there's lots of questions too about how do we become trustworthy, but do we first develop a rapport with our community and kind of build that communication with them? You often talk about how Homeland Security, public safety agencies can become relevant and develop a conversation with their community, even sometimes a lighthearted one, right before the bad news has to come out. Any advice on how we might do that to build trust in small bits before we need to really cash in on that trust and credibility?
Yes, find the ways that you can share newsworthy opportunities. I will give you an example. There's a police department out west that I work with where they're just starting out. And so they're brand new, very few followers on social media, and they're trying to grow that audience. They don't have a lot of news per se. They have experiences. So one of the recent posts that an officer sent me as a suggestion for Facebook was just his laptop computer in like the student union and a cup of tea. And he talked about how just sitting here writing reports, drinking a cup of tea amongst the students. And I just sort of crafted the message to say something about typing in tea, and please, if you see us among you, please come say hi and introduce yourselves. It's like a nothing post. It's certainly not news, but it's you starting to introduce yourself to your public. And the reason that you do that and you put out, there's always the example of we helped the little ducklings cross the road, or the cat stuck up in the tree and the firefighters came and saved the day and we have this great video. Those things take off because our news consumers do need some breaks. 2020 and 2021 has been a lot to take. And so if you have the opportunity to share good to neutral news, find a creative way to do that. Social media is the perfect avenue to do that. Then when the bad thing hits, you've started to build that audience, and they have this feeling about you. They're starting to get to know you. And that's how you slowly over time build trust.
Yeah, if I could piggyback on that as well, I think that's an incredibly important point. And when we think about, from say like a health or science perspective, why certain pieces of information and narratives have taken off the way that they have, it's often because it provides a very human perspective. Right? It's a lot of firsthand accounts. It's very anecdotal. And so that feels very personal. People can relate to it. Right? And when we're combating that type of approach with, well, but here's what the latest article, a double-blinded study from JAMA just said, right? We're not really doing an apples to apples conversation. And so I think exactly what Julie just said, it's really important to note if there are narratives that we're combating that are largely personal, that feel largely anecdotal, personal experiences, we can also challenge those narratives by also bringing in personal experiences, anecdotes, sort of making things feel, bringing things to the very human level, which is what I think Julie's just also talking about, humanizing many of these issues, humanizing these individuals, even as we're thinking about vaccination, how do we humanize that topic, right? I mean, and talk about, maybe have a narrative. I was scared to get the vaccine too. And here was my experience. And I didn't feel that great the next day, but I was fine afterwards. And here's why I got it, right? As opposed to also just presenting the hard evidence, I think is incredibly important. Like identifying the narratives and counteracting those narratives in a similar way, but with the correct information is incredibly important.
Christie, I'm seeing lots of questions coming in today, really asking about the distinction between news and punditry or opinion pieces. Any advice, not just only for our viewers today who need to understand that distinction for themselves, but perhaps even their bosses, right? The folks they work for who are led and make public policy decisions based on that. How do folks know the difference between what is actually news and what is opinion?
It is increasingly difficult, and it's different depending on the platform. So I'll give a couple of examples. So if you are, I don't know, what we would consider traditional news organizations. So I'm mostly talking about, formerly known as newspapers. Many of them still have newspapers, but those kinds of organizations are going to have an entirely separate editorial opinion team. The opinion side of the newspaper is very different from the reporting news side of things. And so it's really important for people to understand that a person who writes for the opinion section will never write a news story, and the reverse is true as well. So when people say, I think the Wall Street Journal is a good example for me because their opinion section is so obviously, and they're very upfront about very conservative leaning, and they make no bones about that. But that's the opinion section of Wall Street Journal, and that should not be confused with any other type of reporting that goes on in the paper. And they're very separate. So from an organizational structure, they don't really interface with one another and they don't share staff. So I think it's important for people to understand that in a way that they might not. Now, it's different on TV, especially different on cable news. I think this is a really important example because as much as we've talked about social media today, cable news is still the most largely consumed type of news out there. And it is 24 hours a day, the same way that social media is. So the cable news stations spend the majority of their time on commentary. News is difficult. News is costly. It costs money to send people around the globe to be first-hand witnesses of news events. That's expensive. And it's much cheaper to have a panel of people talk about what they think about things because all you need are, as a Zoom call at this point. So they fill a lot, increasingly more so, of their 24 hours a day with these types of punditry and commentary. So it is a very common, I don't even know that it's a misconception or if it's just I'm not really thinking about it so much. Sean Hannity, Rachel Maddow, those are very popular people who get a lion's share of the attention when we talk about media. Those people are not journalists and they are not news programs. And they'll tell you that firsthand, but we're watching them as though they are. So, I think that's an easy thing to differentiate for people. You're not trying to convince them not to watch Sean Hannity or not to watch Rachel Maddow, but to be able to frame it in that way. Softa mentioned earlier, having conversations with family, even just recognizing the difference between the reporter who's out in the snowstorm saying, I'm here in a snowstorm, and the people in the studio going, looks like it's snowing outside. Those are two entirely different things. And then the last thing to say about social media is that news organizations are getting better about labeling things. And this is something that many groups have advocated for a long time, because opinion headlines are meant to evoke emotion. And if you think it's a news story, you're going to have that emotion thinking you're looking at news. News organizations have started label stories, opinion, : that sort of thing. And those are kinds of aesthetic markers we want to look for to be able to differentiate.
Great. We're being mindful of time today, but before I go to our speakers for some closing comments, one huge amount of questions that we didn't get to today. So I'd like to let everyone know the Center for Homeland Defense and Security and our partners, really this is a kickoff event. We're going to be continuing these conversations in upcoming weeks about mis and disinformation. Dr. Christie Roshke, who's with us, is actually going to do a lecture. So it goes a little bit deeper into some of the causal elements of communications. What are the drivers? What appeals to us? What appeals to our confirmation biases, right? How we can think about those. And we'll be talking with this panel and some other speakers in upcoming weeks to do a deeper dive on the purposeful disinformation campaigns that are out there from foreign actors and to really kind of take us off our security footings. We'll be talking about that. We're also going to be talking about some of the legal components, some of the First Amendment, freedom of speech, right? How do we maintain a community and a country where opinions are okay and different opinions are okay. And what's the media's role in respecting First Amendment broadcast rights and writing rights, but also doing that in a way that we continue to maintain truth at the root of that. So if we didn't get to your questions today or the ones you submitted in advance, stay tuned. We'll keep you involved and we'll keep the information flowing in upcoming weeks to tackle a few more of these topics in a higher degree and to a deeper extent. So before we wrap up today, though, I'd like to turn to each of our panelists. And Julie, I'll start with you. Really, what if folks took one lesson away from today, again, about this construct and the frame of today's session of building trust in this age of mis and disinformation? What's the one or two things you would encourage them to take back to their teams, to the leaders in their community, to think about how they do that, establish that trust, maintain it, and amplify it?
What is one thing that you can do today in a relative period of calm, given that we're in a pandemic, but what could you do today to build trust that you haven't done before? So whether that means starting a social media platform that you have not yet been on, or dusting off one that exists, but you haven't really been using, doing a town hall with your community to talk about the news of the day wherever you are, whether it's masks, whether it's a series of weather issues, whether there's some sort of something else unrelated going on in your community where everyone's talking about it, but they're not hearing from particular leaders. Think about different ways that you can enhance the trust today, more so than you were tomorrow, and it will only benefit you. And if I can add one more thing, please always remember that urgency is key. There isn't time anymore for so much. And because those false narratives take off so easily on social media, it's really important for you to get out there as early as you can, even if your verified information is limited. Get out there early and own it in whatever way you can, and then build upon your story.
Swapna, I'll ask the same question to you, right? If there's one thing that folks could take away from this conversation today, what can they do to kind of build and amplify that trust?
Yeah, I would say really a key takeaway point here is push the truth. Take it upon yourself to push the truth in whatever way that you can, right? Consistency, data. If you're looking from a scientific perspective, what does the evidence show us? But even if it's not a scientific or health issue, what does the evidence prove? And consider yourself sort of a flag bearer of the truth, right? And sometimes that can be done in a small way, and sometimes we can do that in large ways. And I would say just kind of my point A right there is also, understand what those contributing factors are that are leading to these false narratives, understanding where that lack of trust comes from, and think about how the truth can be utilized, can be a tool in combating those narratives, right? So it's important to combat those narratives, but always push the truth.
Dr. Roshke, I'll turn to you for the final word today. How do we put a bow on today's conversations?
Well, I feel like my colleagues just said all of the really good things. So I think the one thing that I'll add, which sort of echoes what they've already said, which is what is the most useful information that your audiences need in the moment? How do you considering how your audiences are going to use the information, which is particularly important in this pandemic, because they will be using this information. So when you're thinking about how to get it out, you need to think about how people are going to use it in their daily life and construct the messages around that use, because that is a way to make you more needed and be as a more trustworthy purveyor of the truth, because you're giving them the information they can actually use.
Okay. I'd just like to take a moment to thank all three of our panelists today. I think this is a fascinating conversation, one that we're confronting as leaders every moment of every day. So thank you for bringing your expertise to today's conversations. And thanks also to our co-host at ASTO and CLA and IAM and NEMA, the Alumni Association here at the Center for Homeland Defense and Security, as well as at the Naval Postgraduate School, the Alumni Association and Foundation there. Thank you for joining us. As a reminder, a recording of today's session will be posted to the CHDS Executive Education Program website. And as we wrap, a quick survey will pop up on your screen. Give us your feedback and your thoughts on today's panel. And again, as a reminder, we will be doing more in this series to talk about misinformation and disinformation and how you can play your important role in securing the nation's homeland security, emergency management, and public health roles in the midst of all this. Thank you so much for joining us.